Live, move, and have your being with Baaba Cofie.
So let me tell you a true story. Enima is a makeup artist. Perhaps I should say was a makeup artist. So one day on a beautiful Saturday, she's making up a bride, and suddenly she feels something trickling down her legs, and she felt something in her shoes. So she quickly, instinctively, just looked down. Her shoes were filled with blood. You can imagine she was so scared, and the family of the bride felt it was a bad omen. That was the end of her career. She felt so embarrassed, she decided to quit. Years later, Enima finds out she has endometriosis. Today we're having a real conversation about some reproductive health disorders that many women face across the world. A lot of these are silent struggles, and they are often untold, and sometimes we never find out. Today we are discussing uterine fibroids, we are discussing polycystic ovarian syndrome, usually called PCOS, we are discussing endometriosis, and we are discussing adenomyosis. These are very common, but also very much unknown. So these disorders don't just affect a woman's ability to have children. They actually affect their very lives, their ability to live, their ability to love, their ability to dream, and their ability to work. From very painful periods to a lot of bleeding, to the physical and mental challenges it comes with, women globally are struggling. So today, as we have the conversation, it is not just about Enima, nor is it just about me or about you. There is a bigger conversation that we need to have. Women need support. Women need flexible support. They need respect. They need to be given the opportunities, even despite these challenges that they have. And so we want to talk about the diagnosis of these diseases, but we also want to talk about the policies, healthcare system, the healthcare system we have, and even at the workplace, what can we do to support women going through this? We'll be right back.
Live, move, and have your being with Baaba Cofie.
Welcome back to the Live, Move, Have Your Being podcast with me, Baaba Cofie. Today we have an amazing guest. I am so honored to have him here on the podcast. I didn't think he could make the time, but he did. And please let me introduce to you Brigadier General Dr. Ernest Saka. He's not just an obstetrician gynecologist, he has miracle hands. And so, Doc, you are so welcome, and thank you for coming.
Thank you for having me.
Great. So today, as I said, we are talking about uterine fibroids, we are talking about adenomyosis, we are talking about PCOS and endometriosis. And so let me start. We want to understand the medical and the diagnostic perspective of it. Can you briefly explain, just in a short while, what these disorders are, maybe the similarities and the differences?
Right. So if we put together fibroids, adenomyosis, and endometriosis, most of the time, the presentation is very much alike. It's because that's a little different. So we start with how the patients present. Most of them will present basically because of abnormal uterine bleeding, abnormal periods. Abnormal in the sense that they either bleed excessively or they bleed for a long time, most of them. Again, we have what we call pressure symptoms. Fibroids are abnormal growth of the womb muscle, so they expand the womb. Likewise, adenomyosis is abnormal growth of the wound glands. So they also cause expansion of the womb. And basically, in the pelvis there, the womb is not the only thing there. There are certain structures in front, some behind, and some to the side. So you have the bladder in front. So if it presses on the bladder, it does not allow the bladder to perform its normal function of, behaves like a balloon. It expands to accommodate the urine, which is continuously being made by the kidneys. And then when it is convenient, you open the tap, empty it. But then you have this hard thing sitting on it. That's either the fibroid or adenomyosis or even endometriosis. So it does not allow the bladder to expand to its maximum. So very little urine in there, you feel like wee-wee. So you'll be running to the washroom ever so often. Again, if it should press backwards, behind is the rectum. That's where the toilet collects until you are ready and allow it to come. So the same way, just like the bladder, this hard thing presses on it and does not allow it to expand to take that much. So very soon you want to go there and ease yourself. If it presses to the sides, that's where the danger is. Between the kidneys and the bladder are these tubes connecting the kidney to the bladder where urine will pass through. So if it goes to the sides, it presses on these tubes. And first and foremost, you have the kidney is continuously producing the urine, and something is blocking it from getting to its destination. So you have back pressure. So the tube expands first, and then pressure goes into the kidneys, and that can destroy the kidneys. It starts with causing hypertension and then a loss of the kidneys, which is possible. So basically, all three will cause expansion down there. And these are the things they briefly cause. That's what brings them to hospital.
Wow. I think the last thing that we knew was that these disorders can actually cause your kidneys to be destroyed. That's an amazing truth, and hopefully this educates a lot of women out there who know that they are struggling with at least uterine fibroids to take an action. Doc, so how come these conditions, especially endometriosis, adenomyosis, how come sometimes it takes such a long time for them to be diagnosed?
Well, diagnosis starts with the patient coming to the hospital. So if the woman does not know that what she's having is a problem, then we don't start diagnosis. So there's basically a problem with late seeking for help, because our culture, it's as if we teach the ladies to bear pain, and that kind of pain is normal. So they don't seek help, and until it gets that bad before they come to the hospital. And then also, some also have myths that if you go to the hospital and they say you have fibroids, it's operation. So they are scared of operation, they don't want to come. But it's not all of it that needs operation. I forgot to add that all three of them lead to serious infertility. So quite often, they will come because of the infertility, not because they think there's something there or the pain that it gives them during the period.
Absolutely. Oh, wow. So, as you rightly said, they can cause infertility. So, what are the specific things? Is it the blockade of the uterus, What exactly, why is pregnancy not occurring?
Fibroids by themselves to cause infertility means they block both tubes. That's quite rare. Again, if they are inside the cavity, uterine cavity, they prevent the fertilized egg from implanting. That's how they cause their infertility. But when you get to adenomyosis, because it's abnormal growth of the glandular tissue in the womb, the glandular tissue basically is the lining of the inside of the womb. The inside of the womb is lined by some specialized cells. So basically, most adenomyosis are just under in the womb proper. And then it becomes so hard and it prevents implantation. Okay. In endometriosis, we would need to get the intrigue a bit about it before you understand it properly. But then they tend to sometimes block the tubes. Sometimes they tie the ovaries, preventing the eggs from being released. There are times that they cause certain obstructions, preventing the sperm from going in to meet the eggs. Okay? If you bring in PCOS now, how they cause infertility, PCOS prevents ovulation. They normally, a girl child is born with all the eggs she will need for reproduction throughout her life, all suspended in a state of development. After the first period, every month, a number of them would suddenly continue their growth. One of them is selected, the others will die off. The one that is selected, as it grows, it accumulates some fluid. So at maturity, which will be somewhere mid-cycle, the mature egg ovum is about 2.5 to 3 centimeter diameter. Okay? And then this thing is released. It explodes to release the egg. In PCOS, the eggs will mature up to this point. For whatever reason, they are not released. It gets stuck there until another set begins. It also develops up to that stage and gets stuck. So that's how they get the name polycystic ovarian syndrome. So when you do the ultrasound, you see a cyst is water, encapsulated water in places. So you find a number of them in line on the surface of the egg. So if you are not ovulating, if you are not releasing the egg, then you cannot have a child. So that's how they cause their infertility.
Wow. This is very interesting. Doc, and looking at the statistics globally, we see that quite a number of women, for some reason, have these disorders. Interestingly, approximately like 2 to 5% of adolescents have severely painful cycles, and even at that age, it seems they are prone to endometriosis, even adenomyosis. If that is so, it's scary. So even as an adolescent, if you are exposed to these, first of all, why? What causes them? And then what can we do at that early stage?
The why, we don't know. Because if you take fibroids, for instance, all we know is that the prevalence is 50 to 60% in all black populations. I didn't say Africa. Black populations. So the theory is that maybe it has something to do with what gives us our black color, the melanin. Why that is not understood, as against the 25% in the Caucasians. It is not food, because definitely Even coming down locally, the diet of the average Kusasi woman is very different from the diet of the Ghana woman. But the prevalence is about the same. So it's got something to do with the color. Adenomyosis, very little is known about it. We're not too sure what it is. Endometriosis, diagnosis is so difficult. So, in fact, some of the issues that we attend to, we think is just pelvic pain, maybe adenomyosis. So, statistics, at least locally, is virtually non-existent. We are not sure what the population, and we don't know. It is thought that the basic pathology about endometriosis is that specialized line in the inside of the womb, a response to hormones that prepares the inside of the womb to receive the pregnancy. It is thought that some of these cells get lodged outside the womb and they respond to the hormones the same way. So at the end of the cycle, when there's no pregnancy, the preparation that the womb has made, that is what comes out and we see as the menses. For the same cell that is lodged outside the womb, there's no space for it to flow out, but it will also menstruate. So with time, there's accumulation of this blood. It has nowhere to go. The body sees it as foreign. It tries to contain it, and you get adhesions formation. And the severe form of it, we say she has the pelvis, you can't see anything, even when you go in during surgery. Oh, wow. So how and why, we don't know. Now, if we don't know the why and how, it becomes very difficult to prevent.
Wow. So we just need to more or less be checking. And I'm particular about our adolescent girls because currently I don't know the rate at which it is increasing, but we are just wondering, can we do anything to help these adolescents so they don't grow up, get diagnosis late, and perhaps go through many years of infertility before they find out?
One good thing is what we've started, education. Education of the whole population. So that myth that if you are born a woman, every month you should go through pain, we should do away with that myth. That's number one. And that if you are having pain during your periods, if for nothing at all, get to the hospital, get a checkup, and let the doctor tell you that there's no problem. That is the way, one way of making the diagnosis early. For all four of them, once we make the diagnosis that early, the endometriosis, for instance, if diagnosis is made early, you prevent that plastered pelvis issue. And you're able to prevent a lot of its complications. Fibroids, if you get them early, maybe you get advice as to exactly what to do. If it's surgery you need, it's done early for you, and you have your kids as quickly as possible. So number one is education. Education.
Doc, you mentioned that people sometimes are afraid because when you mention fibroids, they are thinking surgery. Yeah. And even perhaps endometriosis and say with adenomyosis. So what are some of the, is it cure? Can any of them be cured? If they are going to be managed, what are the procedures? Even before surgery, is there something that can be done? And at what point do we need surgery?
Let's break them one by one. The commonest is fibroids, okay? It's not all fibroids that need surgery. Fibroids that are not giving you any symptoms. Fibroids that are probably picked up accidentally. You went for infertility treatment and they did a scan and they saw some 2 centimeter fibroid hanging somewhere. It does not need surgery. It needs periodic review to see, because in some cases you find a 2 centimeter fibroid, in the next 3-4 years it's still 2 centimeters. It hasn't done anything. In others, you find the same 2 centimeter fibroid, next 6 months is doubled in size. So we just need to keep monitoring to make sure what yours is doing. But if you have a fibroid that is, we call it submucoid or submucous, that is right under the lining inside the womb, that one, because of its position, would cause a lot of bleeding during your period and a lot of pain as well. So for that one, irrespective of the size or the number, you need assistance. Okay? Sometimes we want to do a myomectomy for you, that is remove out the nodules and leaving the womb there. But because of the way you are bleeding, your blood levels are so low, myomectomy, no matter what you do, there will be some loss of blood. So we want your blood level to be quite high so that we can avoid blood transfusion if it's not an emergency. So that could delay how soon we can act. That aside, it all depends on the symptoms you are showing and then the size. If it's big, the bigger it is, the more problems it causes. Problems from even the incision, how big the incision should be. If it's big, we have to make a bigger incision. Some are big, then you have to go like this. Okay? Those kind of things. If you take adenomyosis, most of the time we are not able to identify that it's adenomyosis. And because of where it is, it causes bleeding, a lot of bleeding. Either cyclical, which is heavy bleeds, or prolonged bleeds, and a lot of pain. Most of the time we find them either during surgery or after we've done a hysterectomy. You cut it, you think you are doing a fibroid operation. You cut through and see that, oh, it is rather an adenomyosis. Ultrasound, MRI, they say they can use it to identify it, but it's not that specific. PCOS, because usually you have an abnormal cycle. Every person should have a regular, not 28. The 28 is the average. Normal length of the cycle is from 21 to 35 days. But everybody is different. The average is 28 days. If somebody has a 28-day cycle and suddenly it drops to 21, it's abnormal, although it's still within the normal. If somebody has a 28 and suddenly it's gone to 35, you need to check and find out why. PCOS, because the egg is not being shed. You see, the normal thing, when the egg is being prepared, it releases estrogens, which tell the womb that you're going to have a visitor, so prepare. So the womb starts the preparation. After the egg is shed, that structure where the water was turns into something else and starts producing progesterone, which sends messages to the womb that the visitor has set off. So the womb tries to put finishing touches to it, to the preparation. That structure has a lifespan. If at the end of its lifespan, no pregnancy has occurred, it dies. Once it dies off, the progesterone that it was producing is cut off. And that's a signal to the womb that, oh, the visitor, for whatever reason, is no more coming. So just like you are in your home, you're expecting a visitor, you start preparing and all that, you get a message that he's no longer coming. You go and clean up. That is what the womb does. So that preparation that it made, that is what comes out as a period. Now in PCOS, the egg is not being shed. So that structure, the corpus luteum that is formed, is no longer forming. So it does not get the signal that the visitor has set off or the visitor is no longer coming. So the endometrium, the womb inside, continues to prepare for the visitor. So most of the time, in their case, in the case of the PCOS, they bleed because the buildup becomes so thick that it can no longer be supported by the hormones. So you have some place, it's not getting oxygen, it's not getting glucose, it's not getting anything. So it dies off, and there's a slough. It breaks down, there's a little bleed. Whilst it's bleeding, the body is trying to repair it. It kind of stops. Another place bleeds off. So they have irregular bleeds as against the normal cyclical that 21 or 28 or 27 days. Okay? The endometriosis, they initially will have normal cycles, regular normal cycles, but with pain, severe pain, which could even be before the periods or after. Now with time, as the endometriosis takes place and destroys other things, it could then affect the hormones and make the period irregular. Okay. Fibroids, we've talked about that already. They would have normal cycles. They have normal periods, except that the periods are heavy, prolonged, and painful.
So you talked about the point at which we need surgery for fibroids. How about do you need surgery for PCOS, endometriosis?
PCOS, most of the time, we try to correct with medications. But when we don't succeed, that's when we go in with surgery, where the type of surgery has progressed from wedge incisions in the ovary. When you go in for PCOS, you find the ovary it's as if some capsule is wrapped around it. It's tough. So they do a cut in there, remove that bit so that the eggs could find a place to come out. Currently, we do drilling. They call it drilling. If we do laparoscopy, then they will just burn holes in there, not major surgery. That's a minor surgery. For endometriosis, if it's early, if they're able to identify it early enough, they go in surgery to just enucleate that part. The fear of that is that if you're not careful, even what has collected in there, in your attempt to scoop it out, some cells are decimated. And wherever they get to, they form another focus and they grow again. But there are instances where we go in and just suck the contents out. That's a form of surgery. Okay. Adenomyosis, that one is treated just like fibroids.
Wow, so we are having a conversation about some reproductive disorders that a lot of women globally are going through or do go through. We are talking about uterine fibroids, adenomyosis, endometriosis, and polycystic ovarian syndrome, usually called PCOS. And we are learning so much. We have kind of discussed how, or we don't know how it occurs, but what we can do when it does. Number one, you need to check yourself out. You need to go to the hospital. We want to look at the daily life and well-being of a woman. And Doc, we know that you've met loads of women who, have presented symptoms, and later diagnosis of these disorders. How do these affect their productivity, career progression, etc., even attendance to work? I'm sure you have quite a number of examples you can share with us.
Basically, like we said, the three fibroids, adenomyosis, endometriosis, they basically present the same. So you have a colleague who every month has to, depending on whatever the symptom is, if it's pain, she's in so much pain. I mean, sometimes those of us who can't bear pain, we can't bear to see others in pain. And it becomes a problem in the office. You think she should go home. Yeah? She should go and see to herself. Initially, your boss may be very, I don't know what word to use.
Adamant support or something?
Supportive.
Yeah.
But if it's a private firm and it goes on like that, she has to leave 3, 4, 5 days every month. It becomes a headache because productivity will be going down. Let's look at it from the point of the client herself. She has to go through this pain every cycle. So when 3, 4 days or a week to the time she's expecting, she becomes anxious and agitated. 2 days to the time, you haven't done anything and she's annoyed. It affects them mentally. Some become depressed, anxiety, panic attacks, and all that. And then those who bleed heavily in the fibroids and adenomyosis, sometimes they need hospital admission. If it's a private company, is it a private company that's going to pay for that, or she's going to bear it? Financial support. Initially, yes, people will contribute and do it, but financial donor fatigue. After some time, donor fatigue sets in. And then she's not able to maintain the productivity that her part of the job that we are doing. And it becomes a problem. Any way you look at it. So from the side of even her colleagues in the office, the women sorry about that. The men are more sympathetic. The women, her colleague women, this month she went home 3 days. Another month home 4 or 5 days, 1 week. Then when it's getting to that, she's about to go again. She wants us to do all the work so that she'll come and collect her pay. it creates
Dr.
friction.
Saka.
It's true. It creates friction at the workplace.
Yeah.
And it's a problem. It's a problem. They need support, yes, but for how long?
Wow. And interestingly, I mean, looking at the age bracket of most of the women, who come in with symptoms, they are, the ones in the workforce. And that's very difficult then. And when moving away from the workplace, then we come to family life. And again, I'm sure you've experienced quite a number of these. How does it affect the relationships in the home?
Family life, fibroids, adenomyosis, endometriosis especially, sex becomes painful. Okay? So she's a married woman and sex is a problem, then the whole marriage is a big problem. Again, if there are kids, they see their mother going through this kind of pain every month, it affects them psychologically. It affects the woman too, for always having to see her children. She tries to hide it for how long? Because she doesn't want them to see her in that state, because she's not comfortable the way they see her to be suffering, so she tries to hide it. But fibroids, for instance, if you are bleeding that much, sometimes they bleed and collapse.
Oh, wow.
Yes.
Oh, my.
How do you hide that? You can't hide it. So all of them, it's a problem that needs to be looked at.
So we've spoken about the treatment options, and whether we like it or not, it's not that simple. So we would have to work with our healthcare providers, to provide the support. But in terms of policy and legislature, I know that earlier this year in Portugal, there was a law giving women a few days off every month. Women who have been diagnosed medically with endometriosis and adenomyosis. And when I read that story, I was amazed. And talking about the fact that genuinely these women are going through a lot of pain and a lot of bleeding. Do you think in terms of legislature, in terms of policy, we should be thinking about that as a nation? Or what are your thoughts around that?
It's not a bad idea, but for me, the businessman is not running a charity organization. Okay? The businessman is in to make profit. So if you make a law making it mandatory for him to allow these women to be off a number of times every month, well, because it's a law, he can't say he's not going to do it. But it's going to block others from getting in. Yes? So I saw that publication, and I was wondering whether I can work here. Because knowing that, it means when you're going for an interview, they'll be asking you whether you have that. And if you dare say yes, you're out. Because he doesn't want to employ you so that he'll be forced to let you off every month for 3-4 days every month. If it happens on the weekend, no problem. But weekday, Suppose it's some shipping line or something, and some consignment of goods are coming in at that time, and you are that person who should be the head of that thing, and then we have to give you off. What happens? So it's a bit dicey. They need our support, yes, but we should be careful on the kind of policies we make, because otherwise we'll put them at a disadvantage. The businessman would not want to employ somebody who will be a burden on him.
Already, some businessmen don't employ women who maybe or could get pregnant. Yeah, so I mean, I totally appreciate what you're saying, but it's like it puts women in a disadvantaged position, doesn't it?
It does. It does. I'm thinking of they forming support groups. Yeah. We tend to, culturally, we tend to keep things to ourselves. But if you get to know that, oh, you are not alone, and somebody gives you his or her perspective of what she's going through, you see that, oh, somebody is even worse off than you. And that alone is healing for you. Okay? So let's educate them, let them form support groups that they can meet and discuss these issues. And then they can even bring out better policies rather than making these kind of blanket policies to force people, to put them at a disadvantage.
Wow, I think that's so super important. Coming together as women to support each other. Yeah, that's really important. And I want to throw the challenge to every woman out there. Definitely, if it's not you, you know somebody who has some of these conditions, and it is time we come together, to support each other and being open, being having the ability to tell your story. You should not shy away from it, even with perceived stigma around some of these things. Until we open up, we might not be able to get anywhere in terms of policy and support in the workplace or anywhere else that we find ourselves. Doc, because you have been in the healthcare system for quite a while, do you think that there are some healthcare challenges that we have that is probably not supporting women the way they ought to be supported?
Our healthcare system has a lot of challenges for everybody. Unfortunately, most of our policymakers are men. And some of these things, they don't seem to understand it too well. And that's where the support groups also come in, where you have women coming together. They know their problem, and they can suggest better policies. Okay? Our healthcare systems, if you talk of, say, PCOS, diagnosis, it's a big problem. It sounds simple, but it's not everyone who can make a diagnosis, even doctors. Okay. Endometriosis, now we have ultrasound all over the place, but how many people can really interpret what they see on the screen? MRI, we don't want to talk about that because the whole of Accra, how many functional MRI machines do we have?
And it's expensive.
And it is expensive as well. So all those things are challenges that, as far as these conditions are concerned, put women at a disadvantage. Because like I said, if the diagnoses are made sooner, then a lot can be done. And if we don't have the things to make the diagnosis, then what happens? So in terms of personnel, even if you have the personnel, the logistics support, laboratory support, they're all not there. You want to do simple hormonal assay, it's not every lab that can do it. You need to go to specific labs to be able to do simple follicle stimulating hormone and luteinizing hormone. And it is expensive as well, cost. I don't know if the National Health Insurance covers those things. I have no idea. And if they are not being done by the government institutions, you have to do it in a private. Let's be frank, how many private hospitals, private laboratories accept National Health Insurance? Okay. So
Wow. Okay. We have been speaking and having a conversation about reproductive disorders that many women are facing. And the truth is that diagnosis is not that simple. And even with diagnosis, the process of treatment has to be discussed, thoroughly with your healthcare provider. And treatment may be through medication, through surgery, but whichever way, it is not a simple process. And you, as a woman, you need to be committed to the process. But then we acknowledge that you would need support also from your family. You need support from the workplace, and we need to support each other as women. Doc, let's round up the conversation. Your final message to women who are presenting such symptoms, not been to the hospital yet, but they are presenting such symptoms and they know it. What would you finally want to share with them? And then also for businesses, managers, CEOs, who have such women in their workplaces, and then also for government. We have a Ministry of Health and those, bodies that are supposed to be supporting healthcare. And so, what final messages would you have for these three?
for the women themselves, they should try to educate themselves. Yeah. Now there's so much information around. I won't say on the net, so much information around, because a lot of the things on the internet, we don't know who posted them. They are not correct. So try and get to the right sources and educate yourself and know what your problem is. Then you can juggle things around and see the way forward. For managers, well, we can only say they should support the women in any way possible, to the point of even finance. Because if you're able to get the woman to solve the problem she has today, subsequently she wouldn't need to go off for 5 days every month. And that can make up for the money you spent. But it all comes with education. They should also be educated to understand some of these things, so that whatever they are doing, they understand what they are doing. Ministry, there, I don't know what they should be doing, because I don't believe in enforcing certain policies. Ghana, we have so many laws which we can't enforce. So why make new ones? If they can put money into women's support groups, I think that would be the best. rather than making policy that cannot be enforced. Women support groups that will help in educating the women. Most of it boils down to education. Because if you build a huge hospital with top of the range equipment and all, and it's sitting unstable, people here do not know that it is there. It's useless. So those of us around need to be educated to know what that structure is, what it stands for, what we can get from there, and the benefit of all that. So that's what I think.
So I'm just asking you one last question. In all your experience, can you tell us one story of a client that got to you, like that you took personally and that got to you so much? I don't know how it got to you, but can you just share a story?
Let me understand you.
Dr. Saka.
Yes, ma'am.
So, was there a particular patient whose story was, touched you so much, and it was actually? I know that sometimes gynaes, can feel for their clients and the pain that they are going through. Has there been any one that was unique that stood out for you? We just want to hear the story.
A lot, not just one. I personally, I kind of try to put myself at the other side, in the shoes of the patient, the client. So I tend to, my clinic, I keep too long because I talk to the clients a lot, and I get to know why they are here, what they've been through, and all that. Almost everybody gets to me, There are times that we have to contribute and pay for our clients.
Oh, really?
Yes.
Oh, wow.
Not in Medifam anyway. in the government hospital in 37, we used to do that a lot. So when we get to know, we take interest in it and do whatever we can. If it means going to fight for waivers, or means personally contributing to some of them, yes, we do. And there's too many to pinpoint one.
Wow. On that note, Dr. Saka, I want to say a huge thank you to you, first of all, for making the time to come and then giving us all this amazing education that, as you yourself have said, is critical, in providing support for women who are going through these reproductive disorders. And so as we round up, I hope you have learned a thing or two. I have learned like 1,000 things. And at the bottom line, at the end of the day, what's important is that women, we need to support women because we understand our bodies. We know what we are going through. Let's form support groups. And even at the level of policy, we are the ones who can drive policy, whether it's at the workplace or wherever it is. If you are experiencing symptoms such as very painful periods, prolonged bleeding, heavy bleeding, please, whether you are an adolescent or a grown-up woman, it is important to get to a gynecologist specifically as soon as possible so that there can be early diagnosis and early intervention. So this has been LMB, Live, Move, Have Your Being podcast with me, Baaba Cofie. I want to acknowledge Mahogany Consult for putting this production together. Thank you so much. I want to acknowledge Nunua Skincare for the sponsorship. And I want to say thank you to my amazing crew. They are behind the camera, so you don't see them. I want you to follow Live, Move, Have Your Being. We are on Instagram, we are on TikTok, we are on YouTube, we are on Facebook. And so support and share. And please, seek help first. Tell a woman to tell another woman, to tell a man, and to tell a teenager. Thank you so much for joining us, and I'm out.
Live, move, and have your being with Baaba Cofie.